infection control, there was a group discussion that rounded up our discussion of yesterday on the types of products used during cleaning. Secondly, the keeping of children at home while they were sick due to their immune system. And thirdly, about the how we navigated on safe sex, surpassing only STI probabilities, but through other cases that will contribute to the long-lasting factors of a relationship. Now, today we'll be moving on to, if you can look at your screen, we have 5 movements for hand hygiene, which we will further dissect as we move on through our notes. But today I want to introduce a new topic to you guys, and that is the using of personal protective equipment, PPE. I think you've heard this numerous times that we've talked about this, especially in the not only the caregiving setting, but also in the health sector, where PPE is one of the most common jargons used there, and it is about personal protective equipment. Okay, so as you can see in your screens, okay, you could see different devices that put together the equipment for PPE. Okay, now the purpose for PPE is for protection. Okay, PPE is used to protect healthcare workers from exposure to infectious agents, hazardous material, and contaminants. Infectious agents, we had talked about this on Monday, where they were split into 4 different categories, where there was a virus infection, bacterial, parasite, or can anyone name the 4th one? Is it like in here? Just check the chat.
Bacteria.
Bacteria, yes, thank you, Laikimi. Bacteria infection. Now, those are infectious agents. Okay, so also PPE acts as a barrier. It acts as a physical barrier to minimize the risk of spreading infections between the healthcare workers and the residents. There are also types of PPE, as you can look at your screen. There is the gloves, okay? It protects your hands from contamination. It must be worn when in contact with blood, bodily fluids, mucus, and contaminated surfaces. There is the gowns and aprons, as you can see here on the right. Gowns and aprons, it is used to protect the skin, okay? Protect skin and clothing from contamination. It is very essential during activities that may involve splashes or sprays of bodily fluids. Masks as well protects the nose and the mouth from inhaling infectious agents. Different types include surgical masks, respirators. Masks are all actually all different. The ones in Fiji, when we had the COVID-19 break, there was multiple masks coming out. There was one that they had used, the respirators. It had a big bump in front of it, but there was only one that was, I think, allowed, which was, and there was only a type of mask that was allowed for people to wear, but due to the, I think the supply, the supply and demand couldn't fit. That's why everybody could wear the surgical masks. Okay, and face shields, goggles, those are also part of PPE. They protect the eyes, the nose, and the mouth from splashes or sprays from bodily fluids. Also the caps, as you can see here on the right. The caps is used in a setting where there is a risk of contamination from droplets or where there is a sterile environment must be maintained. Therefore, you wear on cap so you don't get exposed to the environmental hazardous virus that might be in the area. Okay, so the cap protects the person wearing it, obviously. Okay, now there is also a correct procedure to wearing these PPE. Okay, there's these terms that you will hear called donning and doffing. Okay, donning is following a specific order when putting on PPE. Okay, there's hand hygiene, then the gown, the mask, goggles or the face shield, and then the gloves, right? The gloves is the last thing that you wear. Doffing is when the removing of the PPE, okay? Okay, to remove the PPE carefully is to avoid self-contamination. Okay, the general order is gloves. Since gloves was the last thing that you had put on, it is the first thing that you take off. Okay, your goggles or your face shield, the gown, the mask, and then you are to wash your hands. You see, it reverses. So when you're donning on your PPE, it is hand washing first. Okay, the gown, mask, and gloves. When you're doffing, which is removing, it is the gloves first, the gloves, goggles, mask, and then hand hygiene. And make sure when you're fitting your PPE, it has to fit you really well. Okay, so it's not bulging out and it is also comfortable for you to do that. Okay, and there is also two kinds of PPE out there, which is single use and also reusable. Okay, understanding which PPE items are disposable and which can be reused, following proper cleaning protocols for reusable items as well enhances the choice. Also, it depends too on the supply and demand. If there is a lot, then okay, but if not, then everybody has to be under really strict conditions of reusing a PPE under the conditions that you are not contaminating, bringing the contamination into different environments that you're handling with. Okay, so that's just a summary of what's on your screen right now. Okay, okay, personal protective equipment, we have talked about this. Okay, the types of PPE used in healthcare. Gloves, it is to protect your hands. Gowns and aprons protect skin or your clothing. Okay, masks and respirators protects the mouth and nose. Goggles protects the eyes, and also the face shields protect basically your face and your mouth and nose. The goggles just protect your eyes. Now, personal protective equipment includes gloves, eyeglasses, mask, and clinical attire. Always remove PPE before leaving the clinical area. PPE is not allowed in the hallways. Can anyone give me a rationality on why it is very important for you to remove PPE after leaving the clinical area when moving into the hallways? Anyone?
So that we don't carry the bacteria outside the room.
Yes, thank you for that, Priyanka. So we do not carry the bacteria from the clinical area to the hallways. Do not expose other people to the infectious agents that might have contaminated the PPE. The key aspects, okay, transmission. We talked about this yesterday, how there's different forms of transmission. Okay, based on precautions, these precautions are specific to certain types of infections. Cleaning and disinfection. Proper cleaning and disinfection of surfaces, equipment, and patient rooms help reduce the risk of infection. Okay, we talked about this on Monday, and you've heard this a lot about the modes of transmission. So now when you're hearing this set of notes or when you're reading about it, it should be a clear picture already of what you're looking at. Since we've categorized together that there is bacteria infection, there is a parasite, right? There's fungi, and there's also a virus, okay? So there's categories and also their chances of survival. Therefore, there will be different types of precautions to prevent these transmissions from happening, all right? Okay, so as we move on, okay, so cleaning and disinfection, we talked about this yesterday in our group discussion. I think group 1 had talked about this, where there's a difference between cleaning and disinfecting, okay? Disinfecting is actually the aim to get rid of germs, get rid of the infectious viruses, whereas cleaning is just to promptly, neatly putting things together, sweeping of the house, but not really focusing on the agenda of germs, right? Sterilization. Okay, so ensuring that medical instruments and equipment are properly sterilized before use is critical to prevent infections. It is to ensure that medical instruments are free of all microorganisms, thus preventing diseases and transmission. Something that is commonly used in the aged care setting is the thermometer, the digital thermometer. So if you have more than 4 clients that you're assigned to, and you have to take their temperature for documentation or for whatever purposes that may require you to take that temperature, please, when using the thermometer, wipe it off with a disinfected wipes. So pretend that this is a thermometer. The tip is to wipe it off. Once you've wiped that, and then you administrate it, whether it's oral, okay, whether it's under their armpits. Is my hand up?
Yes, madam.
That is crazy. Was it up the whole time?
Yes, madam, you have to say something.
No. That is crazy. Okay. That is so crazy. Anyways, so yeah, sterilization. Okay. Also, when how I think Ravina had talked about yesterday, where there was a spike of HIV and AIDS due to the sharing of needles. All right, due to the sharing of needles. So that comes with poor sterilization cases. Okay. Poor sterilization cases. That's why HIV and AIDS are able to spread STIs. Due to the
Madam,
sharing
I
of...
wanted to ask one question.
Yes, who is speaking? Priyanka?
Yes, madam, like they say AIDS and HIV, like if, for example, if the patient, he is like, for example, selling something, like for example, juice or something, and he has a cut in his hands and the blood enters the food products or something, any person who consumes will get it, or like
Okay, thank you so much for that question, Priyanka. So the scenario case given by Priyanka is there is a cut in the hand and then he's mixing juice and he's selling it. Will the people who drink get HIV or AIDS? Eh? Okay, is that correct, Priyanka? That's your question?
yes,
okay, so chances are they might not get HIV or AIDS. Hear me out. Now, depending on how deep the cut is, yes, the person is infected, but depending on how deep the cut is and how much blood has seeped into the juice, if the juice container is big, okay, if the juice container is big and there's just like 3, 4 droplets, 5 droplets, obviously the juice will cover the blood. I mean, it will be diluted. But then again, it will be diluted. And then when you drink the juice, it won't, depending on the scenario cases. That could happen, but chances are, whether if it's a lot of blood, if the mixed juice was a lot, there's a lot of variabilities to this. But I don't really think anyone could catch HIV just by drinking juice and blood was mixed into that, because it takes like a level of blood, like a fair amount of blood to be able to infect someone, right? Because by then it's already diluted with the other parts of the juice. Or does anyone else have a interesting theory against that? No, okay. Okay, so we talked about disinfection, sterilization, and transmission, okay? Okay, when you look at your screens, what can you see? Can you describe to me, what is the first picture? What are they doing? What is she practicing? Can you name me the PPE items that she's wearing at the moment?
surgical mask, hand gloves.
Surgical mask, gloves. Yes, thank you, Priyanka. Okay, so she looks like she's wiping down the bed. Okay, do you think that is cleaning or disinfecting?
Cleaning.
Disinfecting.
Disinfecting, yes. Okay, why do you say it's disinfecting, Ruby?
Cleaning.
Priyanka is still with the... Okay, why do you say she's cleaning?
Madam, we can see the detergents, the mom.
The way the person is dressed, you can tell that the person is disinfecting because she's wearing the the PPE.
Okay, yes, Ruby is correct. She is actually disinfecting. Okay, the way that she's dressed also, and also because of the presence of the disinfectant that's in her hand. Okay, yesterday we talked about, Priyanka is going, wow. There's a difference between cleaning and disinfecting. Disinfecting is with the agenda of removing germs, whereas cleaning is just the casual sweeping. The agenda is not to remove any germs, any form of infectious agents. So she is disinfecting. Okay, so picture 2 as well, as you can see, she's not wearing any mask. She's just using gloves. And I think those are disinfectant wipes. Can anyone give me a rationality on why do you think she's not using a mask? Whereas in picture 1, she has a mask on.
Maybe depending on the patients they were looking
Depending
after.
on the patients. Yes, Priyanka? Okay.
Ma'am, the one wearing the mask when the patient was discharged from bed, and the one that cleaning without mask, maybe before the patient was taken into that room, so they do cleaning before the patient comes in.
Okay, yes. Those 2 case scenarios are fairly correct, like Amy, thank you for that. One is when the client comes out of the bed. Okay, picture 1 is when the client comes out of the bed. Picture 2 is preparation. Now, the rationality to reaching that conclusion on why does he think the client is removed? All right, she's wearing a mask in case if there's any body fluid that's on the bed. Okay, if there's any bodily fluid that is still lingering, right? We talked about tuberculosis, how when someone coughs, it still lingers within the air, okay? So the client is still, the virus is still liable out there for you to get it. That's why she's wearing a mask. She's protecting herself from being a susceptible host of the infectious virus that might be present in the room. So that's why she's wearing the mask. Whereas the lady on the right, she's just full on with the gloves and she's wiping because the client is yet to come in or has already been discharged, or they're preparing the place, okay, for the client to come in, which is very correct. And thank you for your observation. You know, a picture is worth 1,000 words, but with the right information that you have, right, you are able to navigate your ways and you're able to depict what is what without moving into narratives, without and trusting your judgment, okay, trusting your observation with the knowledge that you have been equipped with, because everything that we are talking about has already been discussed. We talked about this, therefore I asked you questions. So when you are confident with the information given, when you are in the environment, when you're out there, because let's face it, practical is not the same as theory. We can go on your notes, you can learn as much as you want, but when you're out there in the field, the rationality of things, the practical side of things is not as same as theory, right, guys? So try and link things to reality, link things to real life situations. If you can't go if your imagination is just brought to only a certain place, okay, you don't actually have to go. If you can't see what is the relevance in healthcare, what is the relevance in aged care setting, I can't see myself doing this, but the information seems valid, use it, use the information with your spouses at home, okay? Make it more personal to you, personalized, so it's easier for you to remember, easier to relate to, for you to process the information, okay? So on our third picture, we can see someone who's mopping. Can anyone can see a PPE that is present on the left? Yeah, it's the left side, bottom, where they're mopping.
The pants.
The pants, right? Do you think the shoes too?
The shoes, she's wearing something on her shoes too.
Yes, thank you. Yes, the shoes as well. Thank you, Priyanka. Thank you, Ruby, for that observation. And yes, how like Kimi had talked about, where there is an outside shoes and an inside shoes. Okay, where you just don't come in with that old outside shoes and you walk around with it. We had that discussion, I think that was on Tuesday or Monday. We had the discussion on Monday, right? So there is a certain shoes that you wear in the healthcare settings while you are mopping, so you don't cross-contaminate. While you're disinfecting the area, those are the set of shoes that you wear at that certain time. And then when you come out, you don't wear them out. You don't take that home with you unless you want to carry the same infectious agents, and then you take it home. Just going to check the chat if anybody has said something. Oh my God, my chat is empty. Priyank. Okay, so on our fourth slide on the right, what can you guys see?
Cleaning supplies?
Cleaning supplies.
High service disinfectant products.
Disinfectant products, yes. You can see there's two kinds of brushes, right?
Yeah.
There's one with like the bristles are like far apart, and one it's just like this. It's just together. I don't know the name, but you can tell because of the structure, because how they're made, their purposes are both different. Okay, they serve a different purpose from each other, but they are all used as a form of cleaning, as a form of helping disinfect the area, wherever it is, scrubbing, okay? Probably reaching surfaces, which is too intimate into spaces. Therefore, you use the long ones, okay? It could be a wall, could be the toilet, depending. And you can also see there's different kinds of disinfectants present here. This one here, the red, black and red one, okay? Can you guys guess where do you think this is used? It has this kind of nozzle.
Which one, ma'am?
Toilet bowl.
Yes.
The toilet?
Yes, the toilet, the black and red one, this one. Toilet, okay, or for any parts, that's small to reach and you can just use, okay, that side. So each disinfectant too has different purposes because of the alcohol that is present, okay, antibacterial that is present within the disinfectant causes it to be more important than others, or for it to be like placed certain places. Not everything can be used everywhere, but like Ime talked about yesterday, Dettol is something that he uses for everything, which is interesting. Okay. Now we want to move on to the key aspects. So sorry about that. Let me just move back. The key aspects of vaccination. Okay. Vaccination, healthcare workers should be up to date with vaccinations to protect themselves and their patients. All right. Why do you think a healthcare worker, do you think a caregiver is part of the healthcare facility?
Healthcare facility?
Yeah, is a
Yes.
aged care worker is yes. Yes, Ruby. Yes, the answer is yes. Okay. To be up to date with vaccinations, why do you think a healthcare worker should be up to date with their vaccinations to protect themselves and their patients?
Because while aging, immune system was very weak, so disease virus they love to spread. So as a healthcare worker, you must be immunized because of the virus will easily spread from elderly people.
Yes, that is really true. Like Kimi, thank you for that answer. Because of the diseases that your client might expose you to. So having this vaccination protects you from those diseases, and also will protect you as well. Even if your client probably does not have those diseases, or you're out and you meet someone, but because you're vaccinated, you're protected from passing that disease to your client, all right? So vaccinations help in preventing illnesses, okay? Vaccinations protect healthcare workers from contracting infectious diseases that may be exposed to in the healthcare settings, because in the healthcare setting, you are exposed to everything. Okay? For example, vaccines for influenza, hepatitis B, COVID-19, okay, significantly reduces the risk of infections. Okay, and also maintaining the workforce. If you remember, during the COVID-19, only first liners, how do you put this? First work liners. No, that is not the word for that. Okay, so only police officers, right, and healthcare workers were allowed to be working during the COVID-19.
Ma'am, you mean
Frontline.
frontliners?
Frontliners.
Frontline.
Yeah, that's the word. I was like, first line. The frontliners. Okay, so they were exposed to a lot of things. They were exposed to a lot of health factors, while most of us just stayed home. Most of us were in the comforts of our homes, just being updated with the news, following the protocols and the procedures, whereas these people had to be upfront. These people had to be dealing with a disease that was taking the world globally that nobody knew how to fight, right? On that note of the vaccination, right? So this is kind of sidetracked. On that note on the vaccinations, there was also a lot of political debates on whether people should get the vaccination, right, to be employed, and those people who had free choices not to get vaccinations but still be employed. While most of the job sectors closed down, you had the tourism sector closed down, you had the banks closed down, right? But the people that had to be always in service, right, they had to be vaccinated, and people refused the vaccination. People had many reasons why they refused the vaccination, okay, due to their religious beliefs. And some was just like, the government can't make me do that. Political beliefs as well. There was a lot of issues around getting vaccinations, but everybody has their rights, right? Everybody has their rights. But you as a healthcare worker, do you think it's your responsibility, that it is your duty, your due diligence to take these vaccinations if once again we were to be wiped up with the disease? Okay, I know you come from all different perspective, works of line professionals out here, but if you were to take up a job as a caregiver and there was another sweep of this infection that took the world globally again, and they made it mandatory for vaccinations, where do you think your stance would be? Would you take it or would you not take it?
Kai,
Take it.
Ara,
Ruby will take it, okay?
hello ma.
Why would you take it?
Given my line of work and being exposed to such whatever virus is going around, I better be vaccinated. My system needs to be boosted to such vaccination so it can fight whatever virus that's being around.
That is true, Ruby. You need to be protected. You yourself is the first priority. How can you be out there helping people when you yourself can't protect your own self? You cannot service yourself without this vaccination. Okay, that was just something that really jumped on me today when I was reading about the vaccination, and then I was reminded about how there was just a political, there was a big drama on this. If you can remember, everybody's like, I'm not getting this, and everybody had their own theories. And everybody some was going on herbal medicine, which is the truth. You are supposed to be on herbal medicines. Fijians, the Itaukes, being in a communal community, raised up in the Pacific, right? Raised up in the Pacific, everybody has laya. Everybody has a herbal medicine that their grandmother used to give them. So it was normal already. But then it was like highlighted more, emphasized even more when COVID-19 came, and you're like, you have to take this. And there was a lot of mixtures of this plant mixing with this plant, which made some people even made them more sick, okay? Because they hadn't done their research. They haven't done anything, and they just kept taking herbal medication without refusing the vaccine. And some people actually got more sick when they took the vaccine. People were advised, if you got the vaccine, you'll probably get feverish, this will happen, this. Okay, contact us. Some people died because of the side effects. So imagine that we lived through that era and we are here now today. It's just amazing to think about it. That's just a recap. Now back to our discussion. Okay, so vaccination, healthcare workers should be always up to date. Okay, so vaccination, it is preventing illnesses, okay, maintaining the workforce, right? Because you are always a frontliner. Of course, you have to be there. That's why you have to be updated with your shots. Okay, it also protects your patients. Okay, preventing transmissions, right? That is another word that we can use, preventing transmissions. And also, there's another term called herd immunity. Okay, when the majority of the healthcare workers are vaccinated, it creates a safer environment by reducing the overall presence of the disease, thus protecting indirect protection to those who cannot be vaccinated due to medical reasons. All right. So when there's a majority of people who have chosen to take the vaccination, it protects the other people who choose not to take the medication, to take the vaccination due to medical grounds or due to whatever reason that they may have. Okay, it protects them because it lowers the chances of indirect contact. And even if they come in contact with the infectious agent, it dies. It does not move further. So if this is the virus and it comes in contact, this is the virus, I'm vaccinated, it comes, it goes. I'm still not infected. And then I come in contact with the person who doesn't choose to get infected, I'm not infected. So the person who is not vaccinated, doesn't get infected, which is, that's it. Because I chose to take the shot. And even if this person gets infected because of their choice of not being vaccinated, because I took the vaccination because I am protected, that doesn't make me liable for catching the disease. So whatever disease that they have, because I have the vaccination that protects me, I cannot get it. This is the infectious virus, guys. Infection virus, person who's getting non-vaccinated person, me who's vaccinated, doesn't stick. That's it. I come in contact, virus comes to me, see, this one doesn't stick. So yeah. Right. Also, it is your public health responsibility as a healthcare worker, right? Public healthcare workers, everybody, when they grow up in any community that you grow up, which one to be? I want to be a nurse. I want to be a doctor. That is the most common thing you will hear kids say. Okay, I want to be a doctor. I want to be a nurse. I want to be a pilot. But the most common ones is the doctors and the nurses in the community that is most admired by children. Therefore, you have a role to play to be up to date with your vaccinations because people will be looking up to you. Okay, you have a cohort of people looking up to you, wanting, what are you going to do? Do you think that's the best solution? Right? Oh, because the nurses do it, I'm going to do it. Yes, you have that influence in people. Okay, you are a role model. So it is your public health responsibility to be up to date with vaccines. Use that influence that you have. All right, guys? And then isolation practices. Isolating patients with contagious infections helps prevent the spread to others, and ours as well, our family. COVID-19, one of the regulations was to isolate. As soon as you came back from out of the country or you visited someone's house from somewhere, you were chose to isolate. Now, the reason for isolation practices is for containment of the infection. Okay, preventing cross-contamination, preventing cross-contamination. Okay, isolation practices are designed to contain contagious infections within a single area, preventing the spread of pathogens to other patients, healthcare and workers and visitors as well. Okay, it is very crucial in environments like hospitals and aged care facilities where infections can spread rapidly. All right. If you have teenagers or you yourself enjoy science fiction movies or alien movies, I haven't been up to date with movies lately, but usually when there's an area infected with aliens of some sort, it's isolated. The government puts a dome over it probably that keeps the virus from spreading to the other parts of the world. Okay, the movie goes on that maybe that they take test subjects. They test whether it's in the air, whether it's in the water. Okay, once they find the root of the infection, okay, what kind of microorganism it is, they can work on the cure as well, right? So some of these movies actually make sense, even though they've never happened. They're based on someone's imagination. The rationality behind it actually makes it truthful. Regardless of the events, the fact stays the facts. You do your research on microorganisms, then you're able to find a cure. Okay, so back on isolation practices, it prevents cross-contamination, it keeps the contamination in one area, and reducing outbreaks as well. Effective isolation can significantly reduce the likelihood of an outbreak, which could affect a large number of people and overwhelm healthcare services. I'm not sure about everywhere in Fiji, we have healthcare centers. I think that's what they still call it, right? There's the main hospital that you have, which is in the town, and then you have clinics, you have health centers in certain areas, in rural areas, okay? Rural areas that are far away from town, they have health centers to cater for the sick that may be present in each areas. Now, if a person is educated enough on the awareness of cross-infection, of isolation, on contaminating infections, on protecting, on reducing outbreaks, right? They will do all that they can get to maintain, okay, whatever sickness this, whatever outbreak a person has. More simple example I could give is chickenpox, right? As soon as a kid has chickenpox, the news goes, hey, my kid has chickenpox. They were playing with your kid yesterday. I suggest you keep them at home. You isolate them because you're not sure, probably the virus that causes chickenpox is still in a dormant phase where it hasn't really come out. So everybody that the kid has come in contact from when they have known, please stay home. Please, just still, if you see something, if they get a fever, then your kid probably has chickenpox. Sorry, but yeah. So anyone with the right mindset would isolate their kid, keep them from going to school, from spreading it more to other children, right? Causing a big debacle that doesn't need to happen. So that is why it's very important for you to isolate the infection. So whoever comes in contact with the kid gets isolated as well. And when they see that that kid did not get the infectious disease, nothing's happening, they're good to go, they go to school. While the other kid who actually has the disease has to stay home, get ready, visit the doctor, right? And they stay isolated for another period of time till they are able to go out. So that's a simple example that I could think of is chickenpox. And also COVID-19, everybody had that. And was anybody here got COVID-19? Yes, Ruby, I saw your hand up.
I just want to share something about chickenpox.
Okay.
Growing up, if someone had chickenpox, all the other cousins, everyone, the classmates were encouraged to get it when they're small.
Yes.
So when a kid even when we were in PNG, there was a kid that got it. Everybody sent their kids to school or play date with that child so that everybody could get chickenpox.
Thank you for that interesting story, Ruby. And yes, that is actually something, I don't know why, but people are encouraged to get it at a younger age. That I can vet for, that you're encouraged to get chickenpox while you're younger because it's easier to look after, it's easier to control, and plus the scars will go away over time. Whereas my sister, she's elder than me. She's in her 40s now. My sister's in her 40s now. I was 5 years old. She was 21. Yeah, I was 5 years old. She was 21. She had chickenpox because I had chickenpox, and she's never gotten chickenpox before. Yeah. So when I was 5, I had chickenpox, and that passed it to her, and she was 21. Imagine at that age, and you have all the spots. And she was like, no, yeah. So that's why we have an estranged relationship with my big sister. she feels like I had a part of pulling down her puberty phase. But yeah, so that's why you should get it at a younger age. And that's why now when hurt, yes, Priyanka.
Sorry, madam. My sister also, she got the COVID-19 because she was on the front lines. And by mistake, I went to her house. And the punishment, my God, every 2-3 days they come and poke your nose. Oh my goodness. I cannot, still I can feel that pain in my nose. Because this thing happened when it was like the first COVID thing was happening, like 1-2 cases. They used to lock down 21 days houses. Oh my goodness, I was like locked in a room, and once they come and check her, after that they come and check us too, the kids and us, and then they poke that small needle in your nose. Oh my goodness, that pain, we still have it.
Okay, thank you so much for that, Priyanka, for that personal and traumatic experience that that she said that they had to put it up their nose to be able to for the COVID-19 test. Yeah, that was a crazy time where you had to put it up your nose and then they'll see whether you're positive or negative, if you have COVID-19, if you have the infectious disease, or if you don't have the disease. That is how you check. And yeah, that was, like I said, some crazy times that we lived through, but we are here today. It's like it never happened. Okay. It's like when we tell our children, man, we lived through the COVID-19 phase where it had the whole world, right? I think, Priyanka, you will be a very, very popular old woman when you grow up. You'll be like, I survived that. I was there. They had to stick it up
Yes,
my
ma'am, I
nose.
have stories for my grandkids.
Yes, yes, you do, Priyanka. Yes, you do. So there you have it. You have different kinds of stories out there that has to do with isolation. Whereas how Ruby had shared, people were encouraged, go and get it at a younger age. At a younger age, because it'll be easier to take care of it. The scars will go away. And then you have COVID-19, where it was more serious, where people were isolated, where there was regular checks. So you see, depending on the severity and how much it has affected the society, how the society has managed to put in regulations to help maintain the disease. And if you remember, Dr. Fong would always be updating on the TV on where the virus was going. This is happening. The statistics is this. I think it was every afternoon, guys, right? I think it was every afternoon. Dr. Fong would always update us. Yes, Ilaikini.
Dr. Fong and the 360 and FNPF every fortnight.
Okay, Ilaikini just remembers the money in that season. But yeah, that is so true. They were giving out money. The government was actually assisting. It was giving out 360 FNPF. Right, children, this, that. Yeah, crazy times we live in, and then now it's just enough, no more. Like it never happened. But yes, Ravina, how do I put my hand down?
Ma'am, like for my experience, like when everyone was safe at home and we were out in the community doing our activities, our course of providing medication and things like that. Even though we were registering the one who were needed to have COVID vaccine done with the ID and vaccination, and plenty issues were there. And oh my God, in that weather, we were wearing 3 or 4 overalls on top of, and the gowns and the mask, gloves, 3 or 4, not even 1 or 2. It was 3 or so our nose started to have that mark on top of it. The mask mark on top of it, like another shape has formed on it. So it was like, oh my God, we really have suffered. It was a bad. We were out in the public doing our area. We were supposed to have that test, like Priyanka has said, that we have to have that swab inside our nose and to be checked if we are positive or not. So there was risk to go back home to keep our family safe, and also a risk to be out in a public to provide them with the service we had. So both wise we were just in danger. So yeah, I could say it was like, oh my God, we are going through a war.
Thank you so much for that, Ravina, for your testimony on a different aspect of COVID-19. That she was actually out there where they were wearing 3-4 clothings on top of their own clothing, and then it had to be the mask on while still providing the care. And then there was always the checks, you know. So we have basically a different mix of people present right now. Okay, you have, but all lived in the same era, all lived through the COVID-19. You have the people who is actually out in the field dealing with these problems, and then you have the ones who were sick, you know, getting checked, and then the other people who was enjoying the freebies. But thank you so much for your service, Ravina. I know that you have helped a lot of people that you came in line with. You're such a lovely person. And yeah, thank you for putting, like we talked about the first liners, the first, is it the first liners? The front liners, right? Front liners. The frontliners out there, the frontliners to put up their lives, risking their lives, going back to their families, right? Just to provide that care. And that is going back to what we talked about as your solemn duty, your responsibility as a healthcare worker. Is other lives come before yours, whether you like it, whether you don't. If you picked public healthcare service, your service to humanity always comes first, because you made a commitment, you had a passion that drove you to that place personally, and it was to put other people's needs in front of yours, to help with whatever sicknesses that they have. All right. Okay, so we're moving on. Okay, so vaccination healthcare workers should stay up to date with vaccinations to protect themselves and their patients, which we have discussed. And isolating patients with contagious infections prevents spread to others. Okay, remember. Okay, clean hands, fight the infection, clean hands save lives. Oh my gosh. Do not read fight the clean hands save lives infections. Please guys, it does not read like that. I was just saying that so you guys don't have to make that same mistake. It's fight the infection, clean hands save lives. It's not fight the clean hands save lives infection. Okay, so fight the infection, clean hands save lives. And I think also there was ads during the COVID-19 break where they were like, you know, wash your hands, wash your hands. There was multiple ads, right? Different healthcare settings. Wash hands, save lives, this, that. Oh my gosh. Okay, what do you think of this? All right, so this is our last slide before we move on to our new topic. So what do you guys think of this? Can anyone describe to me what they see?
Needles.
I'm sorry. A lot of rubbish, yes. What else?
Improper disposal of syringes.
Proper disposal, right. What do you guys think that green thing is at the bottom?
The nose thing they used to poke in the.
Is it the nose thing that they used to poke on in the nose?
Is it syringe?
So, yeah. And how old do you think this child is?
Oh my goodness, 9, 10?
Child labor. Yes. And he's exposed to the environment, and look at him, he's just with his bare hands. Let's say these are the COVID-19 tests, right? And he's exposed to it with his hands out and with other type of viruses that we may not know of. All you can see is bacteria, virus, fungi, germs, okay? Anywhere. Okay, this is what happens when there is a poor governance on managing garbage disposal, right? Yeah. So what do you think is your advice? What is your best advice on maintaining garbage disposal or preventing all of this? What is your strategy that you think that you would use?
Proper disposal of
Proper disposal. Okay, but how do you think that will work in this setting with proper disposal? What is a strategy that you could come up with? Let's say it's proper disposal. Okay, so how? What is your first step towards that? You have the
Badly
issue.
bagged properly.
Put it properly.
You put it in a secure bag, like a much contained bag, and you tie
Okay,
it
yes.
properly.
Tie it properly, put it in a more secure bag. That's correct. Ruby, anyone
Well,
else?
when it was COVID time, I saw in one of the TikTok videos, maybe it's correct or no, but all the hospital things, they used to dig it and they used to put it inside and close.
Bury it as well, yes. Thank you, Priyanka. Bury the, I think the PPEs after they're being used. Anyone else? Okay. Okay, so we talked about managing garbage disposal, where you had to, Ruby had come up with tying them properly, putting them places, also burning. Also, a concept that you could come up with is disposing of the garbage differently. As you can see, there is soil as well mixed. I think that is soil as well, and paper, and there's styrofoam, and then these things, and there's plastic. If there was a proper disposal managed, where styrofoams all go here, soil for fertilization all go here, right? You have plastics here. Okay, medical supplies, everything gets buried. Okay, proper management skills on strategizing which goes where. Everything gets disposed, but in a different manner due to the material of the garbage determines how they get disposed. Send them back home after 3 checks. Oh, okay, thank you, Priyanka, for that. I think that had to do with the COVID-19 outbreak. And yes, so keeping children away that are and properly disposable bags for this issue. Thank you so much for your input in the chat. Cleaning detergent. Okay, set. So that runs off our discussion on the my gosh, that runs up our discussion for the infection control. So now we are moving in. No, this is what we talked about. We're moving in the infection and universal precaution. Okay, so this will be our last unit for this week, guys. Okay, so universal precaution. Universal precautions are a standard set of guidelines to prevent the transmission of blood-borne pathogens from exposure to blood and other. Okay, so prevention of infectious blood-borne pathogens such as HIV, hepatitis B, and hepatitis C that can be transmitted through the exposure to blood and other bodily fluids like saliva, urine, and wounds as well. All right. Is the rule across for all healthcare settings. It is standardized. Unless and until it gets updated by WHO, then it changes, then it gets tweaked. Okay, then There's probably a study of people finding this, so they stopped doing this and they moved on to something else. Then it is changed, but you need to be up to date. That is your responsibility to be up to date with what's happening within the healthcare facilities. If they change a rule, if they change, we're no longer doing this, we're no longer doing that, okay, because it brings more infection, we're doing another form of hand washing, right? It's your responsibility to know what is happening in the healthcare center. Nobody has to come in and tell you, oh, so they've changed the rules. It's not like school anymore. No, you have to take it upon yourself. It is your responsibility to know what is the updated standard for things. And also, it's a protection for everyone. The term universal emphasizes that these precautions should be applied in all situations where there is a risk of exposure, okay, regardless of whether the person is known to be infected or not infected. This approach, it ensures that all residents and staff are protected, even in the carers, when infection is not yet diagnosed. You still follow these universal precautions, so it protects you and them. Okay, its relevance in the aged care settings is where residents may have a weakened immune system and they require personal care, personal and up close. All right. So the risk of spreading infections can be higher. Following the universal precaution helps maintain a safe and healthy environment, reducing the risk of outbreaks and ensuring the well-being of both the residents and the caregiver. All right. So the purpose of the universal precaution, the purpose of practicing universal precaution is twofold. Universal precautions protect patients from further harm or infection, while simultaneously protecting the medical or first aid practitioner from contracting a blood-borne illness from an infected individual. Okay, I can see that there is 14 of us. We can't see you. Oh, okay. Can everybody see me? Eli Kimi says he can't see me. Can you guys
Yes,
hear
we
me?
can see you with raise
Yes,
hand.
ma'am.
Yes, ma'am, we can see you.
Okay. Eli Kimi said he can see me. Okay, so
Ma'am,
we'll just
that
go
was
for
5
a,
minutes
I'll put you guys in
ago.
a group, right? What?
That was 5 minutes ago, and then your Zoom went off and then on again.
Okay, so I assign you to groups. Okay, so where you guys can have a discussion. Oh, that was 5 minutes ago. So sorry, I'm reading these things late. Okay, I'm gonna put the chat now, this side. Okay, set. Okay, so I'm gonna be putting you guys in groups. I'll just put up the questions in the chat as well. Okay. So, hold on, guys. Okay. Can you guys still see my screen?
Yes, madam.
Okay, so I'm going to be putting, there's only 14 of us. So we'll just have a short, sweet class today, guys. Okay, so. Let me just pull up the questions. Okay. Okay, guys, hold on. Something wrong with my, okay. Okay, so group 1, I'm going to be putting it here. Group 1. Okay, put this here. The group 1, your question will have to do with what is the primary purpose of universal precaution and in an aged care environment? Okay, group 1. And group 1 consists of, hold on, group 1 consists of Ashwita, Avi, Morin, Nimra, and Ravina. Okay. What is the primary purpose of universal precaution in the aged care environment? And I want your findings to be based on community settings in Fiji. Okay. So what is the primary purpose of universal precautions in an aged care environment in Fiji? So I want your answers to be relative to our communities here in Fiji. So group 2 is Andialisi, Isne, Ruby, and Sangeeta. How do universal precautions contribute to the safety of healthcare practitioners? Okay. And why is maintaining? All right. This is group 3's question. Group 3 is Afsa, Amit, Ilaikini, and Priyanka. Okay, why is maintaining a safe work environment particularly important in a aged care setting? Okay, so group 1, you're talking about the universal precaution in an aged care environment. Group 2, you're talking about how do the universal precautions contribute to the safety of the healthcare? Okay, how does it contribute? We're talking about what is the primary purpose in group 1. Group 3 is why is maintaining safe work environment particularly important in aged care settings? So you have what, how, and why. And all of this has to be based in community settings in Fiji. Okay, I want those answers relative to the communities that you live in. These questions was derived basically when I hear your answers, it's statistics. Yes, it's this about this, that. But I want it to be upfront and personal about the communities here in Fiji. And what is your views? Okay, what is your views on maintaining a safe work environment, particularly important in the aged care settings here in Fiji? Okay, in Fiji, in the community, in the Pacific. Okay, so am I loud and clear with that? Does everybody have that?
Yes, madam.
Okay, thank you so much. I'll be putting you in your groups. So make it upfront and personal, okay? So I'll be giving 15 minutes enough? 15 or 20? 15 to 20?
20 plus 5 minutes
okay.
break.
20. Okay, plus the 5 minutes break. Sorry, like Amy, plus the 5. So it's 20 minutes. Okay.
For them to come over. So the environment of them is like if they're short of money or things, so we provide the service for them, or they can get the service. We get the service to them, not for them to come to us. So we provide those type of service also. And medication also, like the environment, we also use the medication to help them. Sometimes we use herbal medicine and things like that. And to empower people of our golden age to make their own ownership of their healthy plate, to motivate them for the healthy diet in spiritual support and care. And to minimize and where the possible for element to risk and transmit of infection, particular for those caused by blood-borne virus, for example, HIV or some other issues. And for my area, what we do, we get community cleanup groups with our youth and Nasinu town councils to keep the environment clean, so they can breathe healthy air and things like that. And community awareness, disposal of rubbish in a right date. Why I want to say right date? Because some of the people in the neighborhoods, they put the rubbish out and it spread everywhere with the dogs and issues like that. So the environment gets very dirty. So it's not safe for either of us, not for our elderlies, for our children, or for our every age of human being group. So they are all affected in that. And as for clinical sterilized for medical, dental, or surgical equipment, so that they are safe in that environment. And hand hygiene, antiseptic techniques, waste disposal, and especially the diapers these days. And also, like for the environment, before we go out for our old age persons but first we have to look them inside our own house. We take precaution inside our own house to keep things in proper way. Example like needle, knives, and other sharp objects, is they have NCDs and poor eyesight. So if the needle goes in the leg or anything, and they are diabetic, so they might be imputed. So the environment and the precautions we take from our medical care is to support our golden age persons in our community. That's all I have to say from group 1. I hope I did something right. Thank you, ma'am.
All right, thank you so much for that, Ravina, for your discussion on, we had talked about what is the primary purpose for universal precautions in the aged care environment and its relevance to the Fiji communal setting as well. And yes, you have answered that really, really well. You've covered basically how the environment, you also talked on the NCDs. And I just want to highlight on the reasons why Ravina's relevance to the community of Fiji towards those aspects where she just talked about respect. She talked about, I think, they highlighted on NCDs about being an amputee as well. And you see, it didn't really directly go globalized with all these PPE things that we talked about. Now, reason being is Fiji is a very connected community. And she also mentioned about the herbal use of medications, because in Fiji, we do not have serious cases of lung cancer. We might, but the probability and the statistic rate of it is so low. The common diseases that we face in Fiji is non-communicable diseases, NCDs, in our community. And yes, that is definitely the right approach, with just basically the respect, because in the Pacific Islanders, it's basically how we deal with our elders, all right, with the respect that they need, regardless of the aging process that they have gone through and their characterism manners through their Alzheimer's, dementia diseases, or how they may look different now. Okay, does not determine the amount of respect that we still should give our elders. And that is something that she highlighted first with her presentation. And I can see also the chat is heating up. Hi. Thank you. Thank you, Priyanka. Yes, I think Eli Kimi will do that for you. But honestly, yes, that is something that I wanted to look at because it was really relevant, talking about the sharp objects, right? NCDs. So how does sub-objects, the rationality behind it, play a role in NCDs, amputee? It's because when you have diabetes and you come in contact with a sharp object, yes, Eli Kimi.
Ma'am, group 3 already present.
I can hear what?
Group 3 already present.
Not yet. Group 3 is yet to present. Group 1 was presenting.
Oh, sorry.
You're in group 3, right? Okay. So, yes. So we talked about how non-communicable diseases and sharp objects, what was the rationality behind that? It's that when you have diabetes, right, your body takes longer to heal, right? The metabolism rate is really slow. So keeping away from sharp objects prevents you from actually getting a wound, right? So you don't have to, or your client doesn't actually have to go through the whole facade of the healing phase. Okay, you don't also have to put that weight on you, an extra job to look after your client who's already have other conditions, but due to getting injured, okay? So that is an aspect to that Ravina had looked into, and thank you so much for that. Group 2, are you ready? Isna, Ruby, and Sangeeta?
Yes,
Amit,
madam.
what group was Amit in? Group 2? Maintaining a safe work. Oh, no, he's in group 3. Okay. Group 2, are you ready? Who's presenting?
Yes, madam, myself. So
Okay.
our question to the group was like, how do universal precautions contribute to the safety of healthcare practitioners in Fiji? So like first I say by preventing infections, by treating all blood and fluid as infectious, help avoid diseases like hepatitis and HIV. Secondly, by using safety gear like gloves, masks, and gowns, protects against germs. And thirdly, like regular hand washing keeps germs from spreading. And like sorry, Ruby will contribute from here.
Thank you, Sangeeta. So, group 2 was how do universal precautions contribute to the safety of healthcare practitioners in Fiji? Sangeeta has touched on a couple. Another thing we'd like to add is the resource constraints. In areas where the healthcare resources might be limited, the universal precautions are
more likely to engage in their learning, manage their emotions, and ask for support when they need it. And nature is the foundation. Why we have to maintain maintain this because nature is the foundation of our health and well-being. It gives us a clean air, food, water, material, and a space for recreations. And because to prevent workplace injuries, illness, and death, and reduce the risk of spreading infection and diseases to vulnerable elderly residents and help keep staff in this location healthy. So so they can continue to provide their services. Also reduces stress level and level of illness in employees, promote mental health, and reduces staff turnover rates and boost productivity. Some of the reason to it's also it reduce the reduce what we have learned yesterday. The four infection. It reduced the spread of that four infection.
Incidence of infections.
Yeah, the four infection. Yeah, the virus, all those things, bacteria and all. That's why. Thank you.
Thank you
Well,
so
I
much
need to
for.
add, I also didn't get the question properly, but like health risk is also one of the most common uh, community concentration in Fiji. Like some of the hospitals, like public hospitals, when we go, cleanliness is most important.
Okay, thank you so much for that, Priyanka and Elaikini. I know you guys were a little bit busy, but thank you for taking the time out for airing out your answers, Elaikini. Thank you so much for that. And for Priyanka as well for putting in the chat and also sharing with the group. And yes, Elaikini was very correct with your findings when you talked about mental health, right? So your question focuses on basically I'm looking for the question. Why is maintaining a safe work environment particularly important in the aged care settings? Right, stress, mental health. He talked about avoiding falls, diseases as well. Yeah, so it was such a really good discussion that you guys had talked about. Is basically is so everybody can go home safe, like Kimi said. Everyone has the right to go to work and come back without getting a disease or getting hurt. That is the most simplest form that anyone can say it how it is, because yes, that is the truth, right? Everybody has the right to leave the house safe and come back safe. It's a disappointment when you come back home to your loved ones, to your family, sick, injured, or hurt, as well, or stressed out, that you come and air it out with your family members. Okay. So one of the ways that you could actually work through the stress, because you cannot run away from work responsibility or pressure or stress. You could manage your stress well. Okay. Go out before you reach home, go for a bus ride, listen to music, take a walk, okay, connect with nature. Okay, so you can defuse yourself before you come back home, the people that you love. Okay, you can disinfect yourself, you can wash your clothes, you can wash your hands. Okay, take away all those germs. But if you come back with that same attitude that you got from work, from all that stress, and you poured it out on people that you love, that you are never coming back from. Okay, wives knows this. If their husband comes back from any type of stress, they are sleeping outside. Okay, so maintaining your stress levels, like him is laughing, yes. You should treat your wife really well, okay? Don't come back with that stress. Deal with your stress properly. Why, Ruby, stop laughing. Priyanka, no. Unmute yourself, I just saw you. Like him, his face
Sorry,
has
madam.
changed.
Now I have to catch another bus back home. I just got off somewhere. I don't know where I am.
Oh my God, Priyanka, I hope you reach home safely. That is, so we are going to making me work on your facials, okay? Please contact your husband if you are missing. Please tell him that you got off at the wrong place. All right? It's late and it's on a Thursday.
Ma'am, it's nice.
She's
That's
single,
part of our
madam.
plan.
Oh my God. She puts the monkey emoji.
Excuse me, it's a dry week.
Okay, guys. So that is our end of our discussion today. We will continue with this on Monday. That's wrapping up infection control. And then we will be moving on to module 5. All right. Friday, I will be putting out module 2 quiz 3. Okay, so everybody should be completing already their quiz 1. I have students who are still haven't started from spirituality. Please attempt them. So I do not want to overload you with quizzes. Friday, I will be putting it out with your module 2 quiz 3. And on probably Monday or Saturday, I will be putting out the quiz as well for module 3. Effective communication. Then we will move on to quiz 4, which is infection control, which will be wrapped up on Monday. And then the quiz will be released as well. Same week. Okay, guys, you guys have a blessed evening. I see you guys next week, Monday, 5:15, same time. Please, one piece. Okay, if any questions that you have, I will be updating the Viber group on the quizzes if it's out, and your notes as well. Please check your emails. I will see you all next week, 5:15. Goodbye. And Priyanka, please reach home safely.
Thank you for today.
Ma'am.
Awesome, guys.
Yes,
Ma'am, I have a
madam. I'm in
question.
a taxi now. I will reach home safely.
Ma'am, I have a question.
Reach somebody's home safely.
Oh my God.
Ma'am,
Yes,
it's a
you like me.
hibiscus week. So our taste to be, be bit shorter so we can enjoy our hibiscus.
Oh my
After a
gosh.
long time,
See, people are old. You people are old. Don't think of hibiscus.
Ma'am, I
Think of
have a
something
question.
else.
It's already happening. It's already happening here at Dr. Sukuna Park. I'm bringing you live from Dr. Sukuna Park.
Ilakimi has a very educational question. Ilakimi, what's your question?
Ma'am, it was a message, the message from the group chat that those who are not pay their tutorial fee. Ma'am, can you just clarify this about our course fee and the tutorial fee? Is these two different things, or that the tutorial fee are deduct also included in the course fee?
Man, okay, I can't really hear you, Ilakimi. I think your connection went. I don't think anybody heard you because you were scratching. Could you message me and then we?
What about
you want
now?
to try again?
Ma'am, what
I
about
can't hear
now?
you.
Madam, he was asking something about the tutorial and practical.
Ma'am, what about now?
Okay, he was asking about the practical.
No.
Yeah, I can hear you now. What happened?
You can hear me now?
Oi.
Ma'am, you can hear me now?
Yes, I can hear you now. See,
Oh.
Ruby and Priyanka are making fun of you.
Okay, said the tutorial fee and our course fee, is these two are different, or the tutorial fee that we have to send weekly is also part of the course fee? Once we send the tutorial fee, it will be
It's
the
the same.
huh? Can you just clarify with that,
Yeah,
ma'am?
once you send your tutorial fee, it will be on your. Yes, the tutorial fee is the course fee. Once you're paying your tutorial fee, it's your course fee as well. Because I'm not sure about tutorial fees. Where did you see that? Because I'm only clear on course fees.
Yo, and sir, Mr. Who? Mr. Sir.
Anil?
Yo, Mr. Sir. He put it up on Viber.
He what?
He sent the message on Viber group. He said everyone who have not yet paid their tutorial fee, they should pay that tutorial fee, and those who already paid, they can ignore the message. So I just want to be clarified with that. Is it the same with the course fee? So that means
Yeah, it's the same. Tuition fees, yeah, tuition fees. I'm reading the message now. Tuition fees and your course fee is actually the same thing. Yeah, it's the same thing, just different wording that Mr. Anil had used.
oh, okay. And
Because okay, he's a bit yeah, so he's pushing on the fees because as the weeks increases, you guys as well will participate in Red Cross, right? You need to get your certificate for Red Cross for first aid. And you will only qualify if you pay probably 50% of the fees, because we have to pay for you to be able to, I think Red Cross requires $50. There's a certain fee that Red Cross puts on the school for them to do the training in school, right? So amongst pushing up the fees, that's why he had noted 11 students haven't paid anything, because as the weeks increase, you are moving closer towards your first aid training. So that's why, you know.
so, ma'am, how long is the first aid training?
Thank you, Mr. Sir, for your question.
I'm sorry, like in what?
How long is the first aid training, and everyone should attend it?
Yes, everybody should attend it, because see, a Red Cross certificate is recognized globally. Wherever you want to go into the world, the Red Cross is recognized. So it will actually boost up your CV if you have a certificate in first aid training. And it's only 2 days.
Okay.
2 days or 1 day. No, we're not doing Red Cross, we're doing St. John. St. John is recognized globally as well, and it's 2 days.
Okay. The second question,
so St.
ma'am.
John has a different price. Yeah.
Okay. Second question. I've heard from the news that PTI is also a partnership with Sangam Nursing something. Is that will be open this year or next year?
Yeah. Okay, so thank you, Lakimi, for being up to date with the news. Yes, we are actually in partnership with Sangam, and Sangam does the training for the nursing. Yeah, we still haven't been able to establish our curriculum with them, but we are closely working with them, which will be ready probably by next year.
And ma'am, can someone satisfy with a caregiver certificate for also become a registered nurse?
It's a pathway to studying registered nurse overseas. Actually, overseas. Okay, Fiji, I'm not too sure, but with this relationship that we have created with Sangam, you can cross over. That will make you actually an open door to learn nursing as well. With this partnership that we are still creating with it. So there's a certain of curriculum that PTI has to establish first. So it is yet to be in place, but yes, it's a possibility. For overseas, yes, caregiving certificate level 4, you can go into practicing nursing as well. Because, okay, this is the reason. Overseas is basically, overseas, they are, how do I say this? They are specialized, right? There is specialized doctors, pediatrician. Doctors don't know, there's no doctor for everybody. You have pediatricians, you have the aged care workers, you have the people who just deal with diets, okay? Deal with this, deal with this, deal with this. It's specialized. In Fiji, the nurse, they do everything. They do from in the maternity to the men's ward, the women's ward, they're everywhere. Overseas, you have a specialized unit for specialized people. So that's why it's easier when you have the certificate of H4 for you to go into nursing, and you'll just specialize. You won't specialize on kids or other people. You'll just specialize in aged care setting. Just you'll be a nurse, a registered nurse, an NA just for old people, aged care. You get?
Okay.
So
Yes. Yes, ma'am.
you get that picture. Eh? So
Yes,
when you're
ma'am.
going overseas, it's more specialized and it's to that area only. Yeah, Fiji, it's not that. We're not that. How should I say? Our doctrines are not that exposed. It's our curriculum is just closed, not yet that big. Yeah. But with this relationship that we're making with Sangam, yes, it's a possibility to cross over into nursing.
Okay, thank you so much,
God,
Anna.
So yeah.
My question is finished. Oh, ma'am, and
Thank
before
you
we
so
go
much
for the
for your-
weekend, ma'am,
Thank
before we
you.
go for the weekend, you know, yesterday you mentioned that you have noted down all our performance and all our input, and those things will come under our report. Eh? Have you noticed that today during presentation while you're doing the class, like now people started giving their input and everyone was just try to hop in like crisscross. Guys, put your hands up before you give an idea.
Look, Priyanka is putting a gun. Priyanka is putting a gun. Thank you so much for your observation, Eli Kimi. Yes. And thank you so much for everybody's participation. Yes, Isne. Oh my gosh, this class will go on till what time? Okay.
Just to let
So-
you all know, I am home safe.
Thank you, Priyanka. We were very worried about you. We are so happy that you have reached home.
Okay, bye, ma'am. Have a nice weekend.
Okay. Bye, guys. You guys have
Bye.
a safe weekend. I will see you all next week.
Naka.
Morde.
Ode.
Bye bye.